Welcome to Everything Mental Health with your hosts, Stephen Edwards and Maureen Edwards.
Hi, Stephen.
Hey, how's it going?
It's going well. I was wondering about a very important topic because there's a lot of depression in our society, especially in youth. And what do you think is something or things to keep in mind? Like how does a parent tell if their child or teenager is depressed?
It's a very good question. There's definitely a few signs that you can look for. For starters, ask them. Usually they know if they're depressed and they could verbalize it, especially if we're talking about adolescence, which is typically when depression seems to show itself at its highest rate. So you can simply just go up to them and say, have you been feeling depressed? I've noticed such and such are different, and I just wanted to touch base. And depending on your child and your relationship, you might get an open and honest answer, or you might get, no, I'm fine. Depends on a lot of factors, like their personality, but it also depends on your parenting style and what kind of relationship you've built over the last number of years. Mm-hmm. So that's the first thing you should always do. It's super simple, but often ignored.
Yeah, I
Verbalize
think that's a really good point. And I'm even wondering, like, if a parent does approach their kid and ask them, are you feeling sad? Are you feeling depressed? Sometimes kids or adolescents don't even know what depression is or how to discern it in themselves. So what do you think, like, what are some things that a child or a young adolescent, like maybe, okay, let's use 12 to 17, like the prime teenage years. What are some things that might indicate there's a depression going on? Doesn't mean that they need to be medicated or anything, but just sort of to find out if your child needs a bit of assistance or help or direction.
Yeah, medication is always something I would say it's an entirely separate conversation. Just because someone is depressed or you name the diagnosis, ADHD, anxiety, doesn't mean they need medication, doesn't mean that medication is the best avenue. It always should be something that's on the table, I think, but never necessarily the go-to. Because if you look at likelihood of success in medication, it's not super high, especially when used solely. You need to use medication in conjunction with other therapeutic techniques. So let's table the medication talk for a whole other subject. If you're looking at simply, is my child depressed, or they're showing signs that are they depressed, I would be looking at, do they no longer enjoy things that they used to enjoy? And not in the way that is, my child doesn't like playing with action figures anymore, or maybe they don't like playing catch with mom or dad anymore, even though they used to love it. Like, interests change. That's totally normal and part of development. But typically there's certain things, hobbies, that kind of carry on from a young age, or they pick up as they get older. Usually people like something. And if they don't like anything anymore and they're withdrawn and you can almost feel a cloud above their head. You obviously can't see it, and maybe they do a good job of hiding it. Maybe you don't see a cloud, or maybe it's not as pronounced. But typically, I think energy is very contagious. And when someone is feeling down constantly, it has an effect on the entire household.
Mm-hmm. One of the things that you mentioned was that sort of isolation where the kid might now kind of be withdrawing. Maybe the teacher says something, or maybe you just notice that they're not as engaged as they once were. How do you know that this is like not normal, just normal adolescence, or if it is something more other than asking them, like what if they say, oh no, everything's fine, but they're still withdrawing, or what you perceive to be as being kind of an isolated person in the family?
It is difficult to measure because beyond just being depressed, some people are just more introverted and withdrawn, whereas others are more social, extroverted. They recharge their battery by socializing. So how do you discern if your kid is depressed or if they're simply coming into their own person, which is just happens to be an introverted person? So what I would be looking for would be a consistent change behavior. So if what is normally has always been there, suddenly it shifts, and we go through waves of up and down. But if it shifts dramatically and stays that way for a long period of time, it's worth checking in with them. It's worth discussing it with your doctor when you do annual checkups. And just because you're concerned doesn't mean there's anything to be concerned about.
Mm-hmm.
But if you ignore the little signs that present themselves, then you're usually setting your child up and yourself up for a rocky road ahead.
Thank you, Stephen.
Thank you.